Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. Today, we'll be speaking with Dr. Pejman Katiraei. Did I pronounce that correctly?
You got it perfectly.
All right. A board-certified pediatrician, an integrative functional medicine expert who specializes in uncovering the root physiological drivers behind the behavioral and neural development disorders in children. Our focus today is on the interconnected systems that contribute to neurodevelopmental disorders, regression, sensory dysregulation, including gut health, immune imbalances, mast cell activation, mold and environmental toxicity, mitochondrial dysfunction, and neuroinflammation. We'll explore how Dr. Katiraei, if it's okay, I'll call you Dr. K. I've heard.
Sure, Pejman is fine too.
Okay.
We're all just people.
Whatever you prefer. Evaluates children, how he evaluates children through a systems biology lens, and how addressing hidden physiological burdens can dramatically improve function, behavior, and quality of life. Dr. Pejman Katiraei, Dr. K, is a board-certified pediatrician. He completed undergraduate work at UCLA. I also went to UCLA and then obtained his osteopathic medical degree at Western University. He completed a pediatric residency at Loma Linda University, and he stayed on as a teaching faculty for over 4 years. He's completed 2 fellowships in integrative medicine, and he's got nearly 2 decades of clinical experience helping children with severe learning and behavioral challenges, and he's in private practice in Santa Monica. Dr. K, thank you so much for joining us.
Thank you for having me. It's a delight to be here.
That's great. So we're seeing an epidemic of neurodevelopmental disorders and pediatric mental health challenges today. What do you think are some of the factors that are driving this?
It's certainly a hot topic, right? And there are a lot of people asking questions, and obviously no one knows the exact answer. I think when you step back and say what is underlying a lot of these neurodevelopmental, behavioral challenges that children today have, and it's everywhere. And, a lot of providers, and I don't know if you've seen it, but a lot of providers that I talk to have seen, even in the last 5 years, that there's been a spike in the prevalence and severity of these neurodevelopmental challenges. So when we step back and say, well, what the heck is driving this? You get down to basically, in my opinion, 3 core systems that are kind of the pillars of either allowing fantastic and optimal mental health to be there versus a lot of challenges. And that is the mitochondria, if you want to consider them a system, the immune system, and then the gastrointestinal tract. To me, those are the 3 pillars that when they become disrupted or distorted in whatever way, they then create multiple cascades of events in physiological abnormalities that then lead to, presentations that look like autism, right? Where the child is having difficulty socializing. And, one of the challenges I have is a lot of times I see children given that label, but they're able to make eye contact. They're able to talk to you, like they're able to interact. But when you ask the parents, well, why did they give your child this label? They say, well, he struggles socially because in school or other environments, he won't interact with the kids. Sometimes he does kind of little strange things. And why I bring this up is the challenges that are now presenting in the children have become in some ways so complex that we just keep coming up with new labels, right? And it seems like every year or two, there's like some new label that we are coming up with or a diagnosis to explain what these kids are having. But when you step back and say, why do these children behave the way they do? It boils down to usually there's a lot of neuroinflammation, right? Inflammation in the brain that is causing weird abnormalities in how they perceive the world. So you get sensory distortions where the child is overwhelmed by loud and crowded environments. They have issues with clothing. They start having restrictive eating where they become very picky. On top of that, because of certain other chemical abnormalities, you get changes in sleep patterns, you get changes in appetite. So there are, you get changes in all of these different systems that then show up in a odd way where then families say, well, what is going on with my kid? And someone gives them that label. If we say, well, what drives that inflammation in the nervous system, right? If that inflammation in the nervous system is one of the key factors, which I believe it is, and my entire practice is literally around identifying this inflammation, figuring out what's triggering it, and taking care of it. Literally, that's pretty much all I do. We get into environmental factors, right? Certain environmental chemicals and compounds and so forth could drive that, but also the gastrointestinal tract, right? You know better than anyone, and I'm sure most of our audience knows, like when the gastrointestinal tract and microbiome become unhealthy, that triggers a whole lot of inflammation within the nervous system. And because the mitochondria are kind of the stabilizers or essentially the foundation of cellular health, which then influences everything else, it kind of combines into that. And then if we take a step further back and say, well, what the heck is then causing this sudden rise? That is where this, as one of my friends, Patty Lemur, just brilliantly put in a book, and her entire book is literally around this called The Total Toxin Load.
Podcast before, yes.
And that's the whole premise of her book, The Total Toxin Load, which is, over time, we have just kept pouring more and more toxins into the buckets of these little kids. And then I believe COVID was, if you want to consider it a toxin, it derailed the mitochondria, it damaged the gut, it triggered neuroinflammation. So it basically caused the bucket to become even fuller. And then my experience is in these kids whose buckets are ready to overflow, but maybe not there just yet, you add the exposure of mold or dampness, and that just causes the bucket to completely overflow, causing these children to then have these weird constellation of findings in all kinds of different developmental, behavioral, and learning domains.
And this increase in these environmental toxins helps explain why we didn't see this number of kids, decades ago.
Yeah, absolutely.
That's something unique to our present environment.
Yeah. And, what's been interesting is, with me, I've been taking care of kiddos with mold for, close to a decade now. And what I can tell you is the resiliency that kids have against these additional exposures, even in the last 4 or 5 years, has changed. 7-8 years ago, the amount of exposure, and using mold as an example, that had to be there to make the kids sick was actually significantly higher than it is now, where now if there's any moderately significant amount of contamination in the home. And why I bring up mold is, you think about how much time kids spend indoors. And if you have a chain smoker, imagine a chain smoker living in your kid's wall, right, in their bedroom or living room, wherever they are. And this chain smoker is constantly puffing out smoke, except the smoke is a soup of biological toxins that derail the mitochondria, trigger inflammation in the gut, disrupt the microbiome, trigger inflammation in the nervous system. So it becomes this perfect additional load on all of the other susceptibilities, if you want to say, that are there, that then triggers the issue. But the amount of chain smoking biological toxins that now needs to be there to cause their bucket to overflow in comparison to even 6 or 8 years ago is significantly less, because sadly these kids have buckets that are way too full.
Yeah. So the point you're making, or one of the points you're making, is that it's this cumulative load that you have a toxin, you have something else, maybe a food sensitivity, you have stress, you have all these different things that contribute to stress on the nervous system. And it's like a bucket when that bucket overflows. And so if you could empty out part of that bucket and maybe the bucket's only half full, you can withstand some sort of stress from an exposure to an environmental toxin, and it might not trigger anything. But if your bucket is filled close to the top, any extra bit of stress on the system is going to trigger changes.
Yes, 100%. That's exactly the case.
And so it's environmental factors that seem to be so important. But what do we say to the traditional pediatricians and researchers who say that these neurodevelopmental disorders are caused by prenatal brain development differences that can be seen as early as the second trimester, that you can see changes in neuronal patterns in the brains of these kids, and therefore these environmental factors really are not that important?
It's a great question. And I think to answer that, we need to ask what shapes neuroplasticity, right? What regulates and shapes and controls neural circuits? And that's the microglia, right? The macrophages, the primary immune protectors of the brain, the microglia, literally shape and prune and control neuroplasticity. And that has been like really well established in the science. And for everyone out there, if you literally just go type into ChatGPT, Grok, whatever you want to use, microglia, neuroplasticity, microglia, synapses, et cetera, et cetera. Like, this is something that has been really well established in the science. So then if you say, well, if that's true, and I believe that is something that has been, kind of proven beyond any doubt. If that's true, then what the hell pisses off the microglia to then cause them to start having the weird abnormalities that then cause the circuit disruption, right?
Right.
And that is when we ask, well, what would activate the microglia, right? The microglia have two states. They have the M2 state, which is kind of chill, right? They're regulated. They are really, in that case, in that state, they're like the caretakers, right? They're tending to the garden. They're appropriately pruning a branch here, appropriately pruning a branch there. They're helping the circuits form appropriately. When they shift to the M1 phase, and that is like they're having a psychotic break, and now they're taking a hacksaw or a chainsaw and literally just slashing shrubs, cutting down trees, like they're just slashing and burning the garden, and everything is a big hot mess. What would cause the microglia to shift from one phase, caretaker, to psychotic break, arsonist, destroy the garden? And that is some kind of typically infectious or microbial trigger because of toll-like receptors and all of these, funny little pathways that trigger this change. And what we know is when there is some kind of maternal inflammatory or infectious event, the risk of a child having increased neurodevelopmental challenges of whatever sort, including ASD, is significantly higher. So once we start putting this together, then it brings us down to, well, then what would trigger these microglia? And that boils down to a handful of microbes. It turns out certain toxins, even air pollution, can trigger microglial activation. It's when you start looking at the material and the data, you're like, oh my God, how in God's good earth could air pollution and the particulates from air pollution, which do get into the placenta, right, trigger that? On top of that, it turns out that mycotoxins and certain microbial compounds that are released in these damp environments absolutely pass through the placenta, absolutely can trigger microglial activation, and can start that process of neuroinflammation before that poor little baby is born. But clinically, what I find, and
so let me just stop you for a second. So I think the point that you're making is that what is seen as genetic factors leading to these conditions actually can be environmentally triggered, even though they happen in the womb.
100%. Yeah. And if you just logically look at this, and a lot of people have said this, like genetics don't change over decades. They don't even change over 100-year time spans, right?
But it's interesting. Why do these researchers often say, oh, this shows that it's genetic because it happens before the kids are out in the world getting exposed, but they're getting exposed to environmental factors even while they're in the womb through the mother.
Yeah, 100%. And like, this is the part that I think is unfortunate, right? We have a community of scientists that, for whatever reason, are selectively only looking at part of the science. And if you just, I mean, literally anyone nowadays, with any of these generative AIs could literally go do their own research. And once you start digging into the literature, it's insane. Like it's all there. And plenty of data to really support how various environmental factors can absolutely change the neuroinflammatory response in a newborn.
Yeah, it's interesting you bring up the glial cells. I'll be having a discussion with David Perlmutter in a month about his new book, which is about the glial cells.
Yeah, it's huge. It's huge. And I mean, they have become my primary focus in this population of kids. And, it's become my obsession to understand them and understand what triggers them, and then also understand what we could do to help. But one of the things that I see is the babies are born. The first sign of neuroinflammation is actually what I see as severe colic. And the literature also suggests that if a child has severe colic for a long enough period of time, their risk of developing ASD later on goes up 200 to 300%.
Now, what do we call severe colic?
So severe colic, there's regular colic where the baby cries for, a few minutes here and there, easy to console, overall doing well. And then there are the kids who literally just cannot be consoled for the life of them. The parents have to drive them around. They're rocking them. They're holding them. They're bouncing them. They're putting them on the dryer to help them calm down, right? And it's not to say that if your baby has colic, they're doomed, right? There's a pattern that I see over and over and over again in the consultations that I have with these families. So baby has severe colic where they will sleep for an hour or two, wake up crying, have to be held, have to be fed. And then instead of regular colic that usually goes away after 2 to 3 months, this persists well into 5-6 months of age. So it's a very unique pattern that is different than the conventional regular baby colic where they fuss and cry. Usually these babies also start developing some degree of reflux. And so the colic is the first sign of neuroinflammation because that is triggering changes in the microglia, and that changes part of the child's response to the environment. But also the elevations in histamine start causing abnormalities in that child's circadian rhythm. And elevations in histamine is like taking 15 shots of espresso, except you're a newborn, right? You just cannot wind down. You can't calm down. And we see this in the older kids with ASD. And like, this is the part that's so fascinating. If you look at colic and you look at the disturbed in like sleep cycles of older children on the spectrum and some with PANS, they actually look pretty much exactly the same. It's just one is showing up in the newborn period, one is showing up when that child is older, but it turns out it's the same physiological event. And how I know this is in a handful of kids that have had this early on, when I use certain compounds, natural compounds, to reduce histamine, to reduce microglial activation, the kids start sleeping again. So
what triggers the histamine increases, the increase in mast cell activation? Is that an effect? Is that an underlying driver? How does that end up happening in this cascade of events?
So in my myopic view, and I will admittedly admit that I am very biased here because this is the world that I live in. What I see is environmental dampness, so water damaged buildings, as being one of the most significant contributors to this. Now, is it the only contributor? Is that in all kids? Obviously not. There could be multiple other things. There could be chronic infections that are there. There could be multiple other things.
Heavy metals, other environmental toxins.
Yeah. But the pattern that I see is, especially when there's dampness, the other thing that shows up right after or almost at the same time is pretty severe reflux. And when I say that, the babies, normal babies will spit up, right? A little bit of formula comes out or milk comes out and they're fine. Then there are kids that have such severe gastrointestinal inflammation, and this is the first sign of their gastrointestinal tract becoming disrupted, that they start refluxing, and it's like half the feeds that they have come up. They're fussy, they're crying, they're in pain. And we start seeing early signs of food intolerances. So mom has to cut out dairy, mom has to cut out gluten. Later on, when they're trying to feed the child is now intolerant to certain foods, so they can't eat all the foods. And that is the first sign of now their gastrointestinal tract becoming disrupted, because we know intestinal permeability leads to food intolerances, right? And why I bring this up is these patterns start showing up. The kids start developing sensory things. They start getting overwhelmed in loud, crowded environments. They become picky and they won't eat all the foods. And this kind of goes on. The children sometimes start developing ear infections or other respiratory infections or eczema. So eczema being the gut, respiratory infections, ear infections being the inflammation, typically from the environment. And obviously those antibiotics are not helpful. And then this pattern keeps going and keeps going. And then usually somewhere between a year to a year and a half, some kind of other trigger or burden or stressor. It could be COVID. I've seen that. It could be an antibiotic. It could be a host of other things. And we'll leave that for our audience to figure out what those other things may be. But then there's that straw that breaks the camel's back. And physiologically, the parents see all of a sudden a significant regression or significant worsening, where before the child was fussy, they did have some sleep issues, they were a little difficult to console, but they were still babbling, they were still making eye contact, they were still engaging, and then those things disappear. And what I believe is that is the moment where the gastrointestinal tract loses the whatever remnant of integrity that it has, and it passes a certain threshold, and that is when endogenous microbial compounds, it could be various Clostridium compounds, it could be lipopolysaccharides, we don't really know, but it seems that there's a moment when the gut really falls apart, and that causes a secondary wave of microbial toxins. And when we look at what is really, really, really good at disrupting the microglia and activating them through their toll-like receptors, that is lipopolysaccharides and various microbial compounds, right? They are probably the most capable and potent toxin in triggering the microglia. And what I believe and what I see is the children's guts fall apart. That releases all of these toxins. That causes another wave of even more inflammation in the nervous system, which then causes these poor children to essentially lose whatever milestones that they have.
I've really been enjoying this discussion, but I just want to take a few minutes to tell you about a product that I'm very excited about. Imagine a device that can help you manage stress, improve your sleep, and boost your focus, all without any effort on your part. The Apollo wearable is designed to do just that. Created by neuroscientists and physicians, this innovative device uses gentle vibrations to activate your parasympathetic nervous system, helping you feel calmer, more focused, and better rested. Among the compelling reasons to use the Apollo wearable are that users experience a 40% reduction in stress and anxiety. Patients feel that they can sleep. Their sleep improves up to additional 30 minutes of sleep per night. It helps you to boost your focus and concentration. And it's scientifically backed. And the best part is you can get all these benefits with a special $40 discount by using the promo code Weitz, WEITZ, my last name, at checkout to enjoy these savings. So go to Apollo Neuro and use the promo code Weitz today. And now back to our discussion. So you're talking about the fact that the gut has this lining, a mucosal lining that prevents toxins and certain other substances that we don't want getting directly into our system. It's a barrier. That barrier gets broken, becomes more permeable, and then these toxins, including bacteria that die, give off toxins called lipopolysaccharides, and there's a host of other toxins, cytolethal distending toxins. And those toxins that get into the system then create this inflammation. So the breakdown of the gut wall, that increase in permeability, is one of the factors. Now, somebody who's listening to this discussion, who's a bit of a skeptic, might say, well, there's all these kids with these problems. Could they really all be getting exposed to mold? Is there really that much mold around?
So the answer is yes.
Okay.
And again, I'm not saying that this is the only explanation, right? There could be a host of other things, like you pointed out, the metals, Lyme and Lyme co-infections can certainly be even from in utero, right? It could be passed on congenitally. So there could be other things, but I don't see those other things as being as capable of triggering a lot of ENT inflammation. So the recurrent sinus issues, the recurrent ear infections, the recurrent respiratory infections, I typically don't see that with these other factors. And those other factors don't seem to be as capable of disrupting the gut the same way as these damp environments. And just to give you a tiny context, when you look at where do most of our modern antibiotics come from, they come from molds, right? They come from mycotoxins.
Right.
So, and that's just
penicillin being the first one.
Yeah. Exactly. So yes, it can. And then when you look at, this is from the US EPA, if anyone wants to go look it up, 1 in 3 homes in the US are known to have water damage. And this is, from probably a decade plus ago. With the building standards, or lack of, that we have now, and when you think of what is embedded in every single home in the US, drywall. And then you ask, well, why is that a big deal? Until you look at, well, what is drywall made of? Drywall is made of calcium carbonate with heavy paper. And then that heavy paper has literally mold spores embedded in it. So essentially what we have done is create every single home to be a chia pet, right? You just add water, you get mold. And it's one of the misnomers that I think as a community we have not done a good job in is when we say mold, it's actually not mold. Mold is the smallest part of the equation. The toxins that these more toxinogenic molds create, the mycotoxins, they're a small part of the problem. I believe, and Dr. Shoemaker has been talking about this for decades, is the bacterial component of the dampness, the gram-positives, the gram-negative bacterias, are actually the ones that are most dangerous because they're producing in the environment, forget about in the gut, in the environment, they're producing the lipopolysaccharides, they're producing all kinds of different microbial particulates, microbial volatile compounds, and a soup of other biological toxins that we inhale that get absorbed into our bloodstream and affect our system, throughout as they go around and circulate.
Interesting. And in addition, one of the things we've done in building homes is trying to have homes that are more energy efficient. And that means making sure they're sealed. And by sealing the outside of your home, you don't have the breathing ability. You don't have air circulating between the walls. And if some moisture gets into that area, you're going to have mold building up much more quickly than if the home was more permeable, if there was air circulating. So making these airtight, more energy efficient homes is another factor in this.
100%. You nailed it. And, when you add that with now, sadly, more shoddy building standards, I've had homes, expensive homes, like multi-million-dollar homes, 2 years out, they're starting to have issues because a window didn't get flashed properly. One of my best friends, their home, the balcony wasn't flashed properly. So every time it would rain, the water would go from the balcony into the walls, into the ceiling, and then it created literally mold in half the home. And that was like a 2-year-old construction. So it's that. And then again, if we add the bucket of these kids are already full, so their ability to handle any additional toxic load is significantly less than what we had 20 or 30 years ago. Forget about, even 5 or 10 years ago. The picture starts coming together. And then when you put it all together, it's like, oh, it's actually no wonder why so many kids are struggling.
Interesting. Is there a better substance to use than drywall? Is there alternatives out there?
It's something that actually one of my friends, he is working with the Department of Defense to see if they can start developing such. So there are certainly people that are starting to look at this and ask the question of, what can we do? Because sadly, we know military housing is notorious for having, water damage. And I see that also with a lot of rental properties, right? No one is investing the money or time to keep up these homes, right? So a little leak here, who cares? It's not a big deal. It's not a big deal. And then our environmental standards, the lack of certification and really maintaining a high level of accuracy with our environmental assessments, that's another problem, right? Well-intending people who have been trained to think one way come in, they take literally 1 or 2 samples from inside the home, they take a sample from the garden, and then they say, well, garden has more mold than the inside of the house, therefore there is no mold, therefore there is no problem, have a nice life. And you just think about that logically, like, wait, what? But literally, that's what we're doing. It's not that we're breaking it down to the species, right? It's not they're saying, oh, there's a small spike in this toxinogenic mold that wasn't really there outside. There could be a problem. They're not doing this. Literally, it's total mold outside has to be more than inside, and that simple equation is all they're using to say if there's a problem or not.
And then look at all the floods you see in the news all the time, and these hurricanes and these other environmental factors related to climate change that are leading to that's got to drastically increase the risk for mold.
Absolutely. There's one study that I know of where they looked at certain areas that were affected by climate change and hurricanes, and the prevalence of mold in those homes was about 45%, with, I believe, somewhere around 25% having severe contamination, not just a little bit, like severe, significant contamination. So yeah, absolutely.
So what kind of testing do you like to do for your patients?
I wish there was a perfect test that I could say, oh, this is the test we can 100% rely on all the time. There is no such thing. And that's another fundamental issue. What I do like to do, I mean, the first thing I believe is we have to piece together the picture, right? If a child was born, they started having colic, they started having reflux, they had a bunch of ear infections, or child was doing fine, right? They were doing fine until 3 or 4 years old, but then weird things started happening. And that correlates with when the family moved, or the child started school, because 20% of schools have mold as well, right? So it doesn't have to be in the home. I've seen it in the schools. I've seen it in a parent's car. So if the child started having issues at a certain point, we need to ask, well, what could that have been? If the suspicion is there, so as we piece the story together, and that's part of what I do with every single family, we spend an hour, sometimes hour and a half, piecing together the story of how did this all come together. And I'll give you an example. There's this dear family that I was talking to. Both parents are physicians. Their beautiful boy, when he was around 14, they moved to a new home, and within about a 6 month to a year time, he started developing all of these issues: severe OCD, severe anxiety, can't even leave the house. Mom is literally trapped in the home because his separation anxiety is off the charts. He doesn't sleep, like literally they have to give him Ativan, and even with that, he doesn't sleep well. Like severe issues. And it turns out that is when they moved into their home. And, as I was talking to them, they're like, yeah, we did see that some of the things buckling, and there have been some leaks, and, et cetera, et cetera, et cetera. So first of all, the clinical suspicion has to be there. Once that's there, what I like to do, if we can draw blood, is use immune reactions against the molds to see if that child has had exposure. Are these tests 100% accurate? Absolutely not. Generally speaking, are they more accurate than other tests that we have? I would say yes. So,
like for example, urinary mycotoxin testing.
Yep. So urinary mycotoxin testing. I know my dear mentor, Dr. Nathan, recommends this, and I believe in adults they're a very useful tool. You can get false positives from the foods that you're eating, right? So if you eat too much gluten, dairy, peanuts, etc., you can get false elevations. In the little kids, why I stopped using them is when kids become really, really toxic, it seems that they lose the ability to push the toxins out into the urine. So I had plenty of kiddos where like horrendous levels of confirmed contamination, like to the point where the family had to move out kind of stuff. Urine results look completely normal, like to the point where it's like, oh, there's nothing going on, until it's like, oh my God, this home needs to be condemned kind of stuff. So that's why I'm not a big fan of the urine mycotoxins in the kids. Urine organic acids, which is kind of checking the biochemistry, and certain companies like Genova, Vibrant, Mosaic do check for fungal markers. And there are plenty of people that question how accurate these fungal markers are. But basically, this is like the fungus and the molds leave their own biochemical footprint. And these urine tests are looking to see if those footprints are there. 50, and I know these are tests that are used in the functional integrative community all the time. At least 50%, maybe a little higher, close to 60% of the time, a child can have significant exposure, and these urine tests don't show signs of fungal imbalance. So if any family out there listening, if they've ever done an organic acid and outside of their arabinose, the tartaric acid or some of these other markers were elevated, even if it's tiny elevation, that tiny elevation could be a sign that the child has had exposure, and that exposure changed the fungal makeup of their gut, resulting in this abnormal result. So with all of that said, the tool that seems to be most helpful right now in assessing exposure to me is immune reactions in the blood against environmental molds or against environmental mycotoxins, mold toxins.
And which company are you using for that?
So the only company that holds the patent for the mycotoxin antibody testing is Microglia. And their testing is actually pretty accurate. About, I'd say 10, maybe 20% of the time, you get a false negative. And I believe the reason for that is the immune suppression that these children have, because if the immune system is suppressed, it's not producing antibodies appropriately, which some of these kids have.
And mold tends to lead to immunosuppression.
Yes, sir. Absolutely. Absolutely. So if you've got that, right, and you check the immune system and the immune system doesn't show a reaction, it's not because the child wasn't exposed, it's because the immune system is asleep at the job. And with there's another company called Alletes, Allettess, and I have no financial affiliation with either. Alletes I like because it's a little bit cheaper. So if finances are tight, my Mycolab, I think, is a better test. When families can't afford the $400, the Alletes is a $200 test that looks for IgE reactions against molds, which are very uncommon. So for those families that have had their kids allergy tested and the doctors are like, your kid doesn't have mold, have a nice life, only 5 to 10% of the time I see those being positive. And there's a study that demonstrated pretty much the same thing. They check for IgG, so that's the delayed immune response. The cool thing with Alletes is they also check for IgA against some fungus and molds. And why that is helpful is if you see an IgA reaction, that means that that fungus is irritating some mucosal surface. And in theory, you can say, oh my gosh, there's probably some degree of colonization or fungal dysbiosis driving that. That was a lot.
Yeah, no, that's good. And then if you suspect that there's mold, toxins, mast cell issues, where do you start?
The first thing is to really understand what's going on in the environment. Because if you don't, and let's say there is ongoing active exposure, and typically how that shows up is the child's nervous system is on fire, like that example that I gave with that young man. In those cases, typically, regardless to what you do, the child will continue to be inflamed. And it's like playing a game of whack-a-mole. You try something, it kind of works, only to fail later. So understanding the environment and helping to control or address whatever exposure is there is pretty significant. And the analogy,
if there's mold in the home,
yes,
trying to correct that, move out if you have to, or get it ameliorated.
Yeah. And sometimes it's just one dumb leak somewhere, right? It's one bathroom that's leaking into one area. And I've had families where there's one family, their beautiful young lady, 14-year-old, severe PANS, like off the charts anxiety, couldn't leave the house, nauseous, tired, like literally couldn't function. It turns out that the laminate flooring that was in her bedroom and in part of the living room, and laminate is basically plastic, right? So it traps moisture. It hadn't been properly installed. And literally there was visible black mold under that laminate flooring. Family ripped the floors out, cleaned it up. And within 3 or 4 weeks of just getting rid of that, they didn't even touch the rest of the home. Literally by just getting rid of that, she's already doing 1,000 times better. She's going out, she's painting her nails, she got a haircut for the first time in a few years. She's hanging out with her friends. She's chipper. And I bring that up because I think this is an important note to touch on. This isn't doom and gloom. Oh my God. I mean, part of why I'm driven to have these conversations and take care of these families is the beautiful transformations that become possible, right? Where we think like things like ASD or whatever else are just lifelong conditions. Well, they are lifelong conditions if you never take care of where the source of the inflammation and dysfunction came from. But when you do, and you help the child's system start rebuilding itself, dramatic and really beautiful things come. I have multiple, kids that I can think of right off the top of my head with severe level 3 ASD, and like the poor kids who couldn't function, head banging, self-injury, couldn't go anywhere, couldn't take him to the restaurant, couldn't take him to the church, freak out every time they go out. Took care of the exposure, did a few things to detox them, and now they're going to church, they're going to restaurants. Are they totally normal? No. But has their quality of life improved dramatically? Absolutely. And this is the most wonderful part of this conversation, where it gives families the possibility of finding some explanation for why their kids are struggling, and gives them something that they can take an action on to take care of it. And that is, to me, the wonderful part of this. There's hope, there's healing, there's profound transformations that are possible.
So what kind of detox strategies have you found to be effective?
So before I detox the kids, I first stabilize them, because I find when they're not in a stable place and they're still acutely inflamed, everything becomes significantly harder. So with the stabilization, I use certain supplements like DAO enzymes in Mirac, and I'll say there's a Substack that I have out there that has all of this spelled out if you want to include that.
So DAO enzymes are an attempt to stabilize the histamine mast cell factors.
Yes. And by reducing the histamine in the gut, that allows the gut immune system to calm down, because histamine acts as a pro-inflammatory agent within the gut. There's a compound, a supplement that has PEA, polyaminoethylylomide, if I said that correctly. PEA actually is a really wonderful mast cell stabilizer within the gut and within the nervous system. Luteolin, which is something Dr. Theo Herades has talked about a lot and done wonderful research on, is another wonderful compound that also helps stabilize the mast cells within the gut and nervous system. So I usually start with just those, some zinc and D, and see if I can get things to calm down. And why I don't do anything right off the bat is sometimes, especially if there's citric acid or other flavorings or other compounds, those additional compounds actually become triggers to the immune system. So you muddy the waters up. Once that is on board, one of the things that I'm finding to be really helpful, and this is something Dr. Fry has been talking about, Richard Fry has been talking about for eons, is using big doses of folinic acid and certain other B vitamins. It turns out that when you don't have enough folate in the nervous system, your ability to break down histamine is also compromised. So pushing some of these vitamins in a gentle yet significant fashion sometimes helps reset that. B6 is really helpful. And then with that, I bring in some magnesium threonate, which also can help these children calm down because it activates GABA. So I do a few of those things, watch and see how the kid does. And with this, hopefully processed foods, food colorings, all the junk, gluten, dairy are also controlled. If the child starts doing better, which I'd say 60 to 70% of the kids who have the mild degrees of immune activation do, and the 20% that have the severe sometimes need more heavy duty things like peptides or ketotifen or chromalin or more intense levels of immune regulation. But once the kids start doing better, that's when I think binders could be super helpful, right? But one of the things that's fascinating about binders is if we ask, what are these binders binding, right? And not to say that they wouldn't and cannot be binding mycotoxins and certain other things within the bile. But what I believe the binders do is they actually start binding the lipopolysaccharides. So all of the toxins that are within the gut, right, produced by the bacteria that we're leaking through, right, that we talked about early on, that triggered the next wave of inflammation. If you look at chlorella, citrus pectin, activated charcoal, bentonite, cholestyramine, for those that have used the pharmaceutical that Dr. Shoemaker talks about, if you look at all of these and others, every single one of these is to some extent either highly capable or moderately capable of binding the bacterial toxins that are in the gut. And what I think happens is when we use these, yes, they do bind whatever mycotoxins that are floating around and other things. But what they also do is while the dam is still leaking, they basically start trapping the toxins that were in the gut and preventing them from going into the circulation, which helps these kids start doing better.
Interesting. What about using something like serum bovine immunoglobulins, because those are known to bind to LPS?
I love it. I absolutely use those a lot of the time. N-acetylcysteine, once the kids are doing better, is fantastic because it reduces oxidative stress and starts boosting glutathione. One of the things that I have become a huge fan of is the azole antifungals. Sometimes even nystatin, which is non-absorbable, produces dramatic changes. And that is, if you look at what else is triggering the inflammation from within the gut, it's the fungus, right? The fungus go out of balance, candida goes out of balance, they become another trigger for inflammation. And by just controlling them, sometimes you're able to downregulate the inflammation. But what's so fascinating about itraconazole, fluconazole, is these azoles have really powerful and rather remarkable anti-inflammatory properties. So they've been looking at them in cancer research and all kinds of other things. And through multiple pathways, they actually start down-regulating the inflammatory response, especially within the nervous system. And I, for one, am convinced that they are probably one of the most useful anti-inflammatories for the nervous system. And I've had kids where we start them slowly, but we titrate them up. And within 2 to 3 weeks of being on these antifungals, when it's done properly, so you don't just throw it in, kid is still living in mold, their diet is garbage, right? You can't just throw it in and do a Hail Mary and hope it helps. You get everything plugged in. When the time is right and it's used for the right child at the right time, it's sometimes weird how helpful it is. Children that were aggressive, irritable, struggling to make eye contact, struggling to connect, sometimes literally within a few weeks, they calm down. They're much more able to regulate. Their sensory issues calm down. They're able to connect more. And they're one of the most beautiful things is it seems that by downregulating the microglia, these azoles start changing dopamine pathways, serotonin pathways, oxytocin pathways. And why the oxytocin piece I bring up, we know that that's fundamental for human connection. I've had several kids, and I experienced this myself, so I can say firsthand that this seems to be true because I witnessed it in my own nervous system. Oxytocin starts working when inflammation calms down. And the ability for a human being, myself included, to be able to connect with others and be able to experience that flavor of life, if you want to say, right? It's like going throughout your entire life eating bland chicken every day and not knowing that is your experience, right? You eat it and you're like, okay, this is what life tastes like, right? and you build ideas because everyone else is like, ooh, wow, this is so delicious. So in your head, you're like, ooh, this is so delicious, right? Even though the emotional experience isn't there. And when you look at a lot of people that are on the spectrum, they have this flat affect, right? They're kind of like, we speak in almost like a robotic way where there isn't emotional context behind what we say. We say we love you, and in our minds, we really do mean we love you. But that ping of joy and love that most normal people experience when they experience love literally doesn't fire in someone whose nervous system is inflamed. And with these azoles, what's really amazing is when it drops down the microglia, I think it's the microglial tone, and allows them to go back to that M2 phase, a lot of these pathways start working. And I've seen it where children that were, labeled as ASD are now the ones wanting to connect with other kids. They're wanting to make friends. They're wanting to go on play dates. They go to their mom and they give them a hug for the first time. And they genuinely look and say, I love you. And it's just, I mean, I can't tell you. It's the coolest thing you can possibly imagine to see happen when these children, I think for me, it's all of these kids have this ability, right? This is human innate capacity. It's as I'm sure you know with your background, our job is to take away the garbage that prevents that capacity from showing up, right? And these azoles are one of the things that take away some of the barriers that allow these children to express or prevent these children from expressing their love in connection. And that innate gift, that innate ability starts shining through, and it's the most beautiful thing ever.
That's great. I see time is running out. So let's bring this to the close, despite the fact that I had about 20 more questions. So I want to thank you very much for joining us on the Rational Wellness Podcast and bringing us your insights about how interconnected the gut, the immune, and the mitochondria and the developing brain are. How can listeners and viewers contact you and engage your services? And then you have a book that's going to be coming out soon, right?
I do. I'm in the process of writing a book. I think it's going to be called Autism Redefined. That's the working title. And it's literally around this very conversation with a lot of information that families can use with any provider that is open to working with them to literally identify these exposures, control it, and work through the healing process to get their kids into a healthy place. So that's hopefully going to come out late next year. Where they can find me is my clinic website is Holistic Kids with a W. So WHOLISTIC Kids. If they type in my full name, my Substack is there, and some of the protocols that I've published before are out there. So families can start using those to start seeing what's going on with their kids. And I'm also on Instagram with the Holistic Kids handle.
That's great. Thank you so much, Dr. K.
Oh, my pleasure. My pleasure. Thank you for having me, and thank you for hosting this conversation. And, I hope that the time we spent, it will help inspire some families and individuals, who have been struggling to say, my God, is this my kid? Is this what's happening to my child? Because that's the best thing, right? If what we did through this conversation helped some families or individuals have a healthier and brighter life, then everything was worth it.
That's great. Thank you for making it all the way through this episode of the Rational Wellness Podcast. For those of you who enjoy listening to the Rational Wellness Podcast, I would very much appreciate it if you could go to Apple Podcasts or Spotify and give us a 5-star ratings and review. As you may know, I continue to accept a limited number of new patients per month for functional medicine. If you would like help overcoming a gut or other chronic health condition and want to prevent chronic problems and want to promote longevity, please call my Santa Monica Weitz Sports Chiropractic and Nutrition office at 310-395-3111, and we can set you up for a consultation for functional medicine. And I will talk to everybody next week.